Hi there, my name is Natalie and I'm a psychology student at the University of New England. I'll be speaking to you about how to overcome the urge or the habit of hair pulling, also referred to as trichotillomania, by using habit reversal therapy techniques. So trichotillomania is essentially the repetitive urge to pull hair. This is commonly found on the scalp, but can also include the eyelashes, arms and legs as well. So welcome, I thank you for giving me a few minutes of your time in helping you achieve your goal of permanent reduction and elimination of urges of hair pulling. So essentially this video will be structured initially by having an assessment period followed by an intervention stage for the behaviour lasting a minimum duration of 5 weeks. So the first step of assessment is to establish a baseline for the behaviour. This can be done by using a self-monitoring sheet, which will enable us to identify the occurrences, the location, and other contextual information. I've got two templates that are coming up in just a moment. The first one is for the baseline period, which will last 1 week, followed by the intervention self-monitoring sheet, which will last a minimum duration of 4 weeks. So I'm going to speak about two more assessment techniques. The first is to take photos of the before and after of the intervention of hair pulling. So for example, you might take a photo of any bald spots or any sort of skin irritation that's been caused by the behaviour itself and compare that to after, so essentially the end of the intervention. And another really important assessment procedure is a functional assessment of ABCs. So that's an assessment of the antecedents, the behaviour itself, and the consequences. So essentially, it's having a look at what happens before the behaviour. So what thoughts are going through your mind? Are you feeling a little bit more stressed, for example? And then followed by assessing the consequences. How do you feel after you've pulled a hair? For example, some people might feel a reduction in stress or might feel some relief, or it might be quite a soothing sort of process to them. And this allows us to identify whether it is a automatic or controlled or focused process whereby you're either consciously pulling hair or unconsciously pulling hair. So that functional assessment is quite important. So now we're going to move on to the intervention stage, which, as I said, will last a minimum duration of 4 weeks. So essentially, habit reversal therapy provides a backbone to the intervention stage, and it comprises of 5 phases. The first phase being awareness training. So this is building an awareness through those assessments that I mentioned earlier of how often the behaviour is occurring, what precedes it, what follows after, and essentially having that awareness of the behavior and how it manifests itself in your life will actually help in reducing the episodes of behavior and severity of that. Another thing to mention as well is throughout the intervention period, it's important to have a weekly maximum number of episodes goal set. So for example, if you engage in 10 episodes a week, you might want to say to yourself, well, week 1 of the intervention period, I might set myself a goal of only engaging in 8 or less episodes. And gradually you will decrease that until the 4th week of intervention will have a goal of 0. And another thing to mention is that positive reinforcement plays a major role in this, whether it's from a fellow friend or a close family member, a parent, or you engage in self-praise yourself. That is really important to say to yourself, you know, I did really well. I only engaged in 8 or less episodes. I achieved the goal for this week. And even if you experience, you know, pulling a hair, for example, if you're able to say to yourself, no, you know what, I can actually stop this behavior. I don't have to engage in this behavior despite the urges. That deserves praise in itself. So the second phase of HRT is competing response training, What this means is if you feel the urge to engage in pulling a hair, for example, essentially competing response means doing something with your hands other than pulling a hair. So keeping your hands occupied, one way to do this is to have, for example, distractions, which can be in the form of blue tack, fidget spinners, a pen and a book in your hand if you're in a university lecture, for example. Or another way is to actually engage in clenching the fists for a few minutes until that thought or urge subsides. And essentially, it's using muscles that are competing and keeping your hands busy so that you can't pull a hair at the same time that you are doing that competing response. So relaxation training is an antecedent control procedure. It's used to minimize the urges and triggers for the behavior to occur in the first place. So essentially we can do this in three ways. First way would be muscle relaxation by tensing different muscle groups in the body and releasing them. Another way to reduce stress, for example, is meditation, which is more so breathing related exercises and mental reduction in stress. And third is urge surfing, probably the most important in my opinion, because urge surfing essentially allows us to not view an urge in a negative way and have a negative connotation associated with that. So, for example, just like how a surfer would surf a wave, he won't take his surfboard and run towards the wave and crash into it. He'll just go along with the wave. And so, essentially, the way we should view urges is to surf it like a wave. Allow those thoughts to come and go as they please and not have a negative connotation associated to it, because essentially these urges, while they'll reduce over time with this intervention, these urges will still be present from time to time. So phase 4 looks at motivation and compliance. So motivation can be managed by what I would do is to create a pro and con list. So have a few points down for the pros in terms of benefits of overcoming the habit of hair pulling, and writing down the cons in terms of the negative things that are associated with the action of hair pulling. One obvious one being hair loss. And in terms of compliance, this is more so to do with younger children who engage in the behaviour. And this would be involving a parent or a teacher in the process to manage compliance of the project. And last but not least is phase 5, generalisation training. What this basically means is allowing the habit reversal therapy techniques that I've discussed thus far to be employed in different environments or be generalised to other environments and locations as they arise. So essentially one way to facilitate this is by engaging in, for example, clenching of the fists, and various relaxation activities in front of a mirror so that you can see yourself actually completing these techniques successfully, and that in a sense facilitates and builds confidence to then be able to perform this when the situations do arise or when you have those sort of urges. So long-term management of the elimination of hair pulling will be done by having an understanding that small lapses will occur. For example, you might end up pulling a few pieces of hair from time to time. It might happen once a week, it might happen once a month. And you know what? That's okay. It's going to happen. You will slip up from time to time, but knowing that these small lapses will occur and it doesn't have to be a total relapse where you revert back to the behaviour of constantly pulling hair for long periods of time will prevent a total relapse from happening. So I wish you the best of luck. Thank you so much for watching, and all the best. See ya.